RSV Academy. Questions about RSV. Why and how is Galicia, Spain, going to use nirsevimab this season?
Hello, my name is Federico Martinón Torres, pediatrician and clinical researcher in the Hospital Clínico Universitario de Santiago and one of the board members of RSV Academy. And today in this video appeal, I would like to explain why and how Galicia in northwest Spain is going to use nirsevimab this season. So we all know that a revolution in the field of prevention of RSV has recently arrived. First, with the arrival of the next generation of long-acting monoclonal antibodies, and more recently with the approval of the first vaccine for the use in pregnant women. So by the time nirsevimab, the long-acting monoclonal antibody, was approved by the European Medical Agency, in Galicia, in northwest Spain, in March 2022, the Public Health Directorate announced the inclusion of nirsevimab in the public and for free immunization program for all infants. And now the time has arrived because we are about to start the practical implementation of these measures. So I would like to explain you why, and I would like to explain you how this is planned to be performed. The decision and the why was based in well-established background epidemiology, based on many published papers, including information from Galician region. For example, the recently published paper from the Rescue Consortium in Lancet Respiratory Medicine included data from Galicia and established that 1 out of each 56 newborns, healthy newborns, will be admitted to the hospital due to an RSV infection during the first year of life. This leads in our region to an average number of 700 to 1,000 hospitalizations, and with a conservative estimate of about 70% coverage with nirsevimab in the target population, and assuming a conservative estimate of efficacy against hospitalization of around 70% for nirsevimab, the estimations states that in Galicia, the universal immunization plan against RSV using nirsevimab might avert more than 11,000 medical interventions related to RSV, concretely around 400 hospitalizations, 1,000 visits to the emergency department, and around 10,000 visits in the outpatient setting. So with these numbers, the public health authorities in Galicia region decided, and I think Galicia was the first place in the world to publicly announce the implementation of nirsevimab as part of a public and universal campaign. So with this data, the decision was taken. So now the campaign is about to start, concretely in the 25th of September 2023, and all infants born during the season, so from 25th of September to 1st of March, will be eligible. Also, all infants below 6 months by the time of the start of the season will be eligible for nirsevimab administration, and also preterm babies below 35 weeks, including extremely preterm babies, will be eligible to receive nirsevimab, although in this case will be up to 12 months of age by the time the season starts. Also, patients with congenital cardiopathies with hemodynamic affection, cyanosine or non-cyanosine, and patients with bronchopulmonary dysplasia. On the top of that, there is also a wide group of children with high-risk conditions that will be eligible to receive nirsevimab if they are up to 2 years of age by the time of the start of the season. Concretely, these patients will be patients with other pathologies that eventually may have or pose a greater risk for developing severe RSV, and concretely will be infants with severe immune depression, either by oncohematologies entities, primary immunodeficiencies, receiving immunosuppressive therapy, and alike. No, also patients with metabolism inborn errors, also neuromuscular diseases, patients with severe pulmonary disease, patients with cystic fibrosis, any genetic syndrome associated with relevant respiratory problems, Down syndromes, and finally patients below 2 years of age under palliative care. So this will be the target population of this campaign in Galicia, Spain. And how it's going to be administered? Well, it will be mainly based on pediatricians and pediatric nurses and on the hospital setting. Concretely, the patients that are born during the season, starting on the 25th of September up to March 2024, will receive nirsevimab in hospital in the first 24 hours and always before discharge. In addition, those patients in the rescue cohort, namely those below 6 months by the start of the season or those belonging to the high-risk groups, will be also receiving an electronic appointment with flexible appointments to be receiving nirsevimab in their respective reference hospitals. For that, it will be made available a 24/7 system to ensure that all the rescue population will be receiving nirsevimab in no longer than 10 or 14 days. So that's the plan. Of course, any patient that for whatever reason did not receive in hospital before discharge the nirsevimab dose, or couldn't attend in any of the days of their electronic appointment, they will be rescued using the primary care health services to receive nirsevimab. But the idea is to ensure that we achieve a high and rapid nirsevimab uptake to achieve the maximum success of the campaign. In addition, information and educational materials for healthcare providers, parents, and lay public have been generated together with a communication campaign to ensure the maximum participation of eligible subjects into the campaign. And based on the usual uptake for pediatric routine vaccines in our region, in Galicia, our expectations are high and we hope to achieve very high coverage. Since the Galicia announcement that led the implementation of immunoprophylaxis against RSV in a free way to all infants as part of the immunization program, a snowball reaction happened in Spain, and in July the National Advisory Council on Immunization Practice for Spain established official recommendations paralleling those that have been adopted here in Galicia. And as of today, as most of the regions within Spain, we could say that around 90% of the Spanish infants will be immunized with nirsevimab in the upcoming season.